Hey there, everyone. Happy Thursday. I'm Randy Murphy, epidemiologist and director of disease surveillance and environmental services at the Mobile County Health Department. We're coming to you from our downtown Keeler location at 251 North Bayou. I'll give you just a couple of updates as we normally do on the number of coronavirus cases and deaths around the world and in the U.S. and near us. Worldwide, we've crossed the $3 million mark, $3 million COVID disease mark. So 3,222,107 confirmed COVID cases and 228,757 deaths. In the United States, we have over 1 million cases. So the United States makes up about 1/3 of the worldwide number of COVID-19 cases. The U.S. has had nearly 70,000 deaths from COVID-19 disease. In Alabama this morning, the Alabama Department of Public Health live dashboard was reporting 6,943 COVID-19 cases for Alabama with 267 deaths. And in Mobile County yesterday, we crossed the 1,000 case count mark. So we have this morning 1,058 Mobile County residents with COVID-19 disease, and 53 of those have died. I want to talk to you a little bit about some messages. We'll talk a little bit more about data, but our comment from our health officer today is about people who live in high density living situations like apartment complexes, or maybe senior citizen centers. So we've talked before about how in those situations, when you have a complex that has multiple residences in it, the apartment is home. So when we say please stay home, we mean please stay in your apartment, and don't gather in common areas and don't visit other apartment complexes that aren't your family members, those sorts of things. It's really important that you aren't moving about that facility, not going into common spaces, making sure that you're observing the 6-foot social distancing recommendation that's in the state health officer order, and then also wearing cloth face coverings when you're going about. And we realize that it's sometimes hard that when you do have to run an errand, or if you do have to go out of the complex, to go alone if you can, and not go as a family with your spouses and children and aunts and uncles, and be moving about town, or particularly among these apartment complexes or areas where senior citizens are living, because you're putting those folks who are at greatest risk of complications, serious complications, at risk of transmission. Because again, young people, children may be asymptomatic carriers. They may not even know that they're carrying the virus. And it's a very difficult situation, very dangerous for our oldest community members, or those that have underlying medical conditions. So please, if you live in an apartment complex, a senior citizens community, things of that nature, please stay in your apartment and restrict access to those facilities and to your apartment. All right, let me see. So we have not had much changes with regard to the demographics of our patient population, so the characteristics of our patients. We're still seeing the highest numbers in ages 25 to 64, but we do have about 27% of our cases are in that 65 and over category. Still most are female, and most African American. We had some, that we had some trouble over the weekend and going into this week with running the data, so we've not been able to provide the complete information on zip code in our table, but that should be corrected tomorrow. So those of you that have missed seeing that, thank you for your patience. I'm a director of disease surveillance during the day, and then I become an epidemiologist at night when I have time to do data analysis. So thank you for your patience on that. We have 134 patients hospitalized who have been hospitalized with COVID-19 disease. Again, that's about 16% of all of our cases. And our 53 patients who died with COVID-19, that is about 6.5% of all of our cases. That has gone up, and it is largely due to the outbreaks that we have going on in congregate settings. So I've mentioned before that we have 6 or 7 outbreaks going on in congregate settings, and the ones that are occurring in nursing homes are very difficult situations, and we have had a large number of our deaths related to those outbreaks in nursing homes. So I'll try to tell you a little bit more about that as we are able to parse out the information on what the disease transmission looks like within congregate settings where we have outbreaks, and what it looks like just in the community spread where it's moving person to person in a different manner than in nursing homes where people are in very tight quarters. So I wanted just to give you a little bit of information that I've not made public yet before now. Last week, we had begun to supplement our case investigations with a team that conducted follow-up interviews on as many of our first 610 cases of COVID patients that we could. So we took about the first 30 days of our outbreak that resulted in about 610 cases, and we had a team call them back and ask them some questions about how they were doing and try to get some more information about who these folks were. And so I just want to give you the information verbally on that, and then I'll try to add it to our daily report tomorrow. So we weren't able to reach everyone, of course, because we still continue to struggle with getting good contact information on many of our cases. But of those that we were able to interview, 16% were known to be healthcare workers. So that is something important for us to recognize, that we know we have transmission to and among healthcare workers, and most likely from healthcare workers to residents of healthcare facilities. Among those 610, again, that we were able to contact, around 10% were known associated with a long-term care facility. Our outbreaks have expanded in long-term care facilities since then, so it was 10% with that first 600 people. If we are able to collect that information, or when we're able to collect it going forward, we expect that that will increase quite a bit. Among 437 who were known to be symptomatic the first time we contacted them, 44% had recovered by the time we spoke with them last week. So that's really interesting information and good to know. We keep emphasizing that most people will recover from this illness. Many of them will have a mild illness. And this is good information that at least among our first group of people, that around 44% had recovered by last week. Illness duration was only known for a small number, but among those, average duration of illness was 13 days with a range from 1 to 33 days. Now, about duration of hospitalization, we had even less information on that because, again, the number that have been hospitalized and died is quite small. But when we tried to reach them last week, among those that we were able to reach and were hospitalized, the average duration of hospital stay was the average was 8 and the range was 2 to 19 days. And of those that were hospitalized, we have some idea about what hospital they're at. Nearly half of them were at Mobile Infirmary, around 21% at Providence, 20% at Spring Hill, 6% at University, and 5% were unknown or missing. So again, these are not hard facts and figures that are going to stay stable and going to stay our truth throughout the continuance of the outbreak, but we will continue to look at this information and try to use it to help guide decisions about mitigation in the community, about public health orders, about restrictions, that sort of thing. And we just wanted to let you know that we are looking at that and give you some of those sound bites that you've not heard from us before. So on to some information sharing. A really important change from the Alabama Department of Health Bureau of Clinical Laboratories in the manner in which specimens can be collected and submitted to the state lab. Previously, it's been only a nasopharyngeal swab or an oropharyngeal swab, which needs to be collected by a healthcare provider, and that requires, staff, personal protective equipment, and the right testing materials. There were some other, specimens that could be collected, like nasal aspirates or sputum, if you had a productive cough, those sorts of things, but still had to be collected by a healthcare provider. And the important change that went effective yesterday is that an anterior nares specimen can now be collected and submitted to the state lab in the same transport media for testing. So this is basically a nasal swab using a flocked or sponge polyester swab to sample both nares, so both nostrils, with the same swab. Place that into a single tube containing viral transport medium and ship it to the laboratory. So this is a huge advancement in the ability to test patients, because these nasal swabs can be done under the guidance of a healthcare provider, but can be performed by the patient themselves. And so as long as someone is observing, the patient can swab themselves, put the swab in the transport media, the provider can close the tube, and it can be shipped to the state lab. So this is really important because it will help protect our healthcare providers, so they don't have to come in close contact with patients who need to be tested, and it reduces the amount of PPE that is required to pull that specimen, because there's a less risk of droplets being generated during that process. So this is really good news. We're going to be pushing out information to all of our healthcare facilities and all of our long-term care facilities to make sure that they get this information, because this is a great alternative to testing using a nasopharyngeal swab. Also, I didn't bring it with me, but very shortly you will see testing locations made publicly available on a website. I don't know where, but previously we'd been using the testing location map that the Alabama Public Health Department made available, but through our Unified Command, our Joint Information Center, the folks who do public information for the City of Mobile, for Mobile County Health Department, and for the county commissioners, they've put together a list of about 10 locations around the county where testing is available, with the phone number to call and the location, and we're trying to get that information made publicly available to you in the form of a map. We've been talking about the Walmart site, the site that Walmart is going to run in Saraland. So we'll work with our public information officer to make sure that gets posted to our Facebook page and linked to this live Facebook today, so that you'll have that information. What made me think of it is the Walmart run clinic in Saraland is using this nasal swab process for their testing, so that you will be, if you drive up in your car, you'll provide some instructions about collecting the specimen yourself, and you'll be a healthcare worker will observe you as you take that specimen to make sure you do it correctly before you drop it in the tube and then hand it back. Okay, a couple of reminders from the Centers for Disease Control. These are just the top messages that CDC wants to remind us. I know sometimes we get in the weeds about things, and every once in a while it's good just to remind you of sort of the high level recommendations. So we really want to slow the spread of COVID-19 and coronavirus transmission around our county and region. The way to do that is to stay at home as much as possible, to stay at home if you feel sick. If you're an older person or a person with an underlying condition that puts you at high risk for serious disease, stay at home and away from other people. Wear cloth face coverings in public settings where other social distance measures are difficult to maintain, like grocery stores and pharmacies, especially in areas of significant community-based transmission, which is what we have going on in Mobile County. So our health officer has strongly recommended the use of cloth face coverings. That's hard for me to say sometimes. Anytime you're out and about in the community, and as we are starting to see some businesses partially reopen, retailers partially reopen under the new safer at home order that begins, I think, today at 5 o'clock. Hopefully you will see more retailers open, but we really want to emphasize to retailers that your employees wear face coverings to the greatest extent possible, and that you request or require that retail shoppers in your stores do the same. Okay, another tip from CDC: know how to protect yourself and others. Wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public area or after blowing your nose or coughing or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Put distance between yourself and others, so stay at least 6 feet away from others, and clean and disinfect frequently touched surfaces. So any high touch areas, countertops, railings, doorknobs, clean and disinfect those frequently and at least several times a day. And then know what to do if you are sick. CDC has a self-checker that can help you make decisions about what to do if you think that you have symptoms of disease. Follow instructions from your physician, and if you have an emergency warning sign, get medical attention right away. So those are just some high-level reminders that we wanted to share. I think I might skip this one and save it tomorrow. So I have 2 pages of questions here from Facebook and from our media partners. So I will try to get some of these answered. Let's see. Why are you guys not working on getting a city ordinance in place? Most people out are not wearing any kind of face coverings already. So the county health officer, Dr. Eichhold, has jurisdiction for health over the county, and he has issued a strongly worded health order about the wearing of cloth facial coverings. It is not a mandate, but it is a strong recommendation that you do that. Has the Mobile County Health Department released guidelines for child care centers? So the Mobile County Health Department is falling in line with the state health order that was presented by the governor and the state health officer earlier this week, that goes in effect to 5 o'clock today. So you'll be able to find those for child on our website or on our Facebook. For child care centers, the restriction stays in place that each room should have no more than 11 children and 1 teacher, and there should not be gathering in spaces like during recess or during lunch or other breaks, and when people are entering and exiting the building. So those things are still very much in place. Let's see. Someone's asking if our daily case count of COVID-19 includes people that test on the antibodies, and the answer is no. The confirmatory test for COVID-19 disease continues to be the PCR test for the presence of virus in the respiratory tract. That is a CDC recommendation and decision, and we continue to follow that. There are limitations to what information can be gleaned from an antibody test, and if I have time today, I'll talk more about that again. If not, we'll talk about it tomorrow. But no, antibody positive tests are not counted as a confirmed case of COVID-19. Let's see. Why open the mail here in Mobile? So there is some data out there that provides some guidance on how long coronavirus can live on cardboard, on plastic, on hard surfaces like steel. And on cardboard, it's around 24 hours. And there are guidelines out there for mail handlers, who are delivering the mail, and also for people at home who may be a little bit concerned about accepting mail and maybe getting contaminated through the mail. The take-home message is, once you receive a package from your 2-day free shipping big box online retailer, when you open the package and reveal the contents, wash your hands with warm soapy water before touching your face. This is just in an abundance of caution to make sure that you don't have virus that you're getting off those packages and putting them into your mucous membranes. But for the most part, a package that has been packed by someone in a warehouse that maybe coughed on it, By the time it goes down the conveyor and in a plane and onto you, there's no virus left on it. Someone's asking, can I address roughly what percentage of new cases are coming from known group, from clusters, and what from community spread? So this is a big to-do item on my list. We're trying to, the clusters are growing rather quickly, and it takes a lot of manpower to get the names of those information and get those into our data system so that I can split out the cases that are occurring related to clusters and the ones that are occurring into the community. But this is an important step for us to be able to do this and to be able to rely on that information. So I'm working on it. So hopefully I'll have some information for you soon. All right, let me answer some of these media questions. Look at my clock because I need to make sure I'm done before the mayor does his live post. Let's see. So there's a question from someone asking for more detail on what's happening in nursing homes and detention facility. There I go touching my face when I told you not to do it. Can I talk about how many cases are at each nursing home and detention center? We can't give details on each facility. Sometimes the facility release that information on their own, particularly if it leaks to the public. And we generally reflex to, please, if the facility wants to release that information, then we are happy to then comment on it. But we don't release that information. That's their story to tell, as I keep saying. But in aggregate, so if I just say sort of in general, we know that many of our deaths are related to the outbreaks in congregate settings. I think in all we have around 30 deaths so far that have happened in our congregate settings and these outbreaks in long-term care facilities, and that is a large proportion of the total number of deaths that we are seeing in Mobile County. So I can maybe say more on that later after I'm able to have confidence that we have the data entered as timely and correct as we need it to. See, someone's asking about clarify the number of reports each day going up. That I usually say there's around 30 to 40 reports each day, and does that mean that people are catching the virus? And the answer is a lot of people are catching the virus. So yes, in the past 3 days we've had 45 new cases, 39 new cases, and 49 new cases. Most of these are symptomatic patients who have recently caught the virus and are now sick and getting tested. Some of these are employees or residents of congregate settings that we are testing to find out to what extent there's virus in those congregate settings, and they're testing positive, but they're not sick. So yes, we know that number is a mixture of people who have tested positive, who have symptoms, and who have tested positive but do not have symptoms. And I will try to see if I can start breaking that out, because I know you're going to ask me for that information in tomorrow's Facebook Live. But yes, around 45 on average added each day for the last 3 days. So this question is about, in the beginning, everyone was asked to stay at home and businesses were closed to slow the spread of the virus as to not to overwhelm hospitals and healthcare workers. Even with these precautions, cases continue to rise, and hospitals are having to, where are these patients going? So I think the gist of this question is, we asked for we put some community mitigation measures in place to slow the spread, yes. And we watch to see what happens when we do that. It seems that our state leaders, with maybe a lot more information than we have here locally, have decided that to try to reach a balance between, opening up businesses that provide services that we all are missing in our lives, that they've decided that some partial relaxation of the public health orders is okay right now. And we will continue to monitor that extremely closely. You know that this order only goes through May 15th, so that's just 2 weeks. So we will closely monitor what happens with this slight relaxation of restrictions that will begin at 5 o'clock today. If it looks like the cases start rising in response to the relaxation, or if people are not adhering to the measures of staying 6 feet away and limiting the number of shoppers to 50% and those sorts of things, then I expect that you might see another sort of restriction of movement. So we may see over the course of the next month or maybe 2 years this sort of back and forth where we are able to, we kind of go really conservative. We believe we're slowing it down, so we try to relax a little bit. And if it starts to hedge back up, then we may see things tightening back down. So you can expect that this ebb and flow may happen as we continue to learn more about how compliant people are with the community mitigation or the health measures that are put in place, how well they're working, those sorts of things, because we will continue to keep an eye on the outbreak to try to make sure that it doesn't hit that really quick peak that will potentially overrun our healthcare system. So far, at least in Mobile and Alabama, it looks like we've done a good job of slowing the spread so that our healthcare facilities, our hospitals were not overwhelmed. And now we're saying, okay, let's lift up a little, let the hospitals and healthcare get back to doing some non-essential procedures, let some retail open up, let's see how it goes. So largely, it's up to all of us to follow the health orders to see if we can keep these relaxations in place. Okay. June, did you have a question? Nope, we got 3 minutes. Is that what you're telling me? Okay, good. All right. I think, so there's a question here. Let me address this. I'm not sure. This will be the last one. I think this is from the media. And somebody's paying attention to that report that I put out every day. And it says, the report used to say about the deaths that they had underlying medical conditions, developed symptoms consistent with COVID-19 and were hospitalized at the time of death, and that I took that out of the report. Does that mean that that is not true? No, it does not mean that that's not true. It just means that I did not have time to 100% double check that that statement was true. So I'll be looking at those and hopefully be able to put that back into the report tomorrow, or come up with something slightly different if we find out that we have had deaths and people that did not meet that circumstance of having underlying conditions. So more to come tomorrow. Thank you for your attention, and everybody stay safe out there and have a good day.